From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Madeline Holler. Tonight, we take a look back at the top health and medical stories, from how a doctor's personal bias could get in the way of your health care, to how light therapy can help people suffering from PTSD.
A study by an Arizona cardiologist indicates doctors can shortchange their treatment of African American and Hispanic patients.
Cronkite News reporter Ashley Carter talked to physicians about the unconscious bias and what patients and doctors can do to address it.
The doctor's office seems to be the best place to go when you're feeling ill. However, some research shows physicians may not listen as well to their African American and other minority patients, affecting their health. Joy Hale remembers when a doctor misdiagnosed her valley fever that led to health complications.
Started with a cough, and before long, my organs were affected by that.
Hale says she repeatedly asked for help, but didn't get it until she went to another doctor.
I don't think that just every doctor from every culture can handle the symptoms, the concerns, or even understand fully the concerns that different cultures have.
A 2018 study by Arizona cardiologist and researcher Dr. Khadijah Breathitt says physicians often treat African American and Hispanic patients differently than non-minorities.
It's bias more than racism. By bias, meaning that you don't necessarily recognize that you have more of a predilection for a certain group than another.
The study also shows doctors are less likely to refer minority patients to specialists because they assume such patients cannot afford it or would not follow their doctor's guidance. A Tempe doctor says she's aware of the problem.
I've seen it in practice that patients who are Black or a minority tend to get passed up as far as early diagnosis and treatment. That's always the main goal when treating patients. And they're often passed off as, oh, you'll be okay. It's almost a blind eye in medicine, and it happens more often than not.
Breathitt says unconscious bias is likely one reason.
The majority of physicians mean to do well and mean to do the right thing with their patients, but it's hard to see what's unconscious unless you're taking steps to become aware of the issues that you have.
She says medical schools conduct diversity training, but that has been inconsistent.
It's a hard thing to address especially when you don't recognize that the problem's there or you don't think the problem is real. There are a lot of people that say, I don't see color. I treat everybody the same.
Glover remembers a time when her bias got in the way of treating a patient.
He's a white, scrawny kid. And looked like he could have been on drugs.
Glover says the patient pleaded to be heard. Once she took the time to listen, she figured out he was gravely ill.
He was a near miss because of my biases and my colleague biases.
Patient Muhammad Kayali says he's talked to doctors and been to hospitals that judged him based on his name.
They see the name, they look at you and they're like, oh, is you Muhammad? Like, yeah, okay, well, come this way. Like, they just want to get me out of there.
Experts say one way to address the issue is to increase the diversity of doctors. According to the Kaiser Family Foundation, about 6 out of 10 medical school graduates in the U.S. are white. The 2017 report shows African Americans make up less than 6% of graduates. Hispanics make up less than 5%.
There's not enough of us to spread around to take care of everybody. And there are a lot of targeted initiatives to grow the pipeline so that we can raise up more minority physicians and more women physicians, and particularly cardiologists.
Experts say it isn't practical or necessary for patients to only seek out physicians of the same race or ethnicity. Instead, seek other qualities.
And what I tell providers as well as patients is to try to develop a relationship where there's trust so that you can identify common ground where you can see that person as your loved one. Oh, that guy, they kind of reminds me of my brother, or kind of reminds me of my mother or my father. And even if the situation gets a little bit uncomfortable, you're more willing to show empathy and show a lot of care with that person because it's your family member or like a family member.
Glover says she promotes her work, not her race.
It's, easy to see that I'm a Black doctor. when I market myself, I want patients to get a new idea, new medicine, if you will, to come to my practice and get time. I don't spend 5 to 7 minutes with my patient. I sit down and talk to them 20 to 30 minutes at times.
Patients of all backgrounds need to shop around for doctors. Now Glover's patient, Joy Hale, says she's happy.
As an African American, it's important to me that I feel like I'm heard and understood.
Breathitt says patients need to realize their value when talking to their doctors. She says everyone deserves trust, respect, and appropriate care. Live in downtown Phoenix, Ashley Carter, Cronkite News.
The birth of a child should be the happiest time for a new family.
But according to the Arizona Department of Health Services, about 1,000 women die every year from complications related to pregnancy and childbirth.
Cronkite News reporter Alexis Pulick spoke to a family who lost a new mother.
Complications can arise during delivery or even several days after. That's what happened to Ariana Dottie, and her family doesn't want others to experience their suffering.
It's supposed to be such a happy day, a celebration, and my daughter goes into the hospital and doesn't come back out.
Ariana Dottie's pregnancy was normal. In August, she gave birth to her third child. Everything appeared fine, but then she experienced complications.
Yeah, I get a call from her mom saying that she's back in the hospital, and so I just go to the hospital and to find out what's going on. And when I got there, she was already passed. I spoke to the medical examiner's office yesterday, and her death is classified as natural causes, and but it was a torn uterus where all the blood loss came from.
Senator Kate Brophy McGee heard this family's story and wanted to help. McGee is sponsoring Senate Bill 1040. If passed, the bill would create a committee of medical experts to make recommendations to avoid maternal death.
So the committee actually has two tasks, and the first is to make sure that the data is up to date and that we have accurate and complete data, not just for maternal mortality, but also maternal morbidity. And the second task is to develop recommendations from there for our hospitals, our birthing centers, our nurses, our doctors, our OBGYNs, to ensure that the proper care and follow-up following a birth is provided.
According to the Global Burden of Disease study, the U.S. has a higher rate of maternal mortality compared to countries like Germany or Spain.
In Arizona and the rest of the U.S., it's been getting worse year after year. And so the March of Dimes and a lot of other folks are really out there saying, hey, we've got the ability to do better. Let's do better and prevent some of these maternal mortality tragedies.
Senate Bill 1040 passed the Senate and is being heard by the House Health Committee.
I think that it's important to recognize the people that have come forward to share their story. These folks are working professionals, nurses, parents, and they take time out of their day to come down and talk about how important this is.
Garcia hopes that this bill will help educate families on the risks associated with pregnancy and birth.
I feel like ringing an alarm bell, so all the mothers and soon-to-be fathers could just be aware, so they can go in and ask questions and be self-advocating.
In the House Health Committee hearing today, Senate Bill 1040 was passed, and it will continue making its way through the legislature for possible approval. Alexis Pulick, Cronkite News.
Veterans are often thanked for their service to our country, but some veterans are still fighting internal battles like substance abuse disorder long after they retire. Madeline Holler took a trip to Arizona's Footprints to Recovery, a treatment center that promises better days ahead.
I spoke to one veteran who shares his story on addiction, overdose, and recovery. He's using his experiences to help others.
this than I was to go to boot camp.
Nick Kratzer, a U.S. Marine, like most veterans, have a love for country. But without realizing it, sometimes serving your country can have unforeseen impacts to your health. He was discharged from the armed forces after a knee injury. What started out as using prescription drugs to control pain shifted to opioid addiction. Kratzer and Dr. Caitlin Simpson spoke with me over Google Hangouts.
And I was with, a bunch of peers that had shared similar stories, about their feelings and whatnot. And that's when I came to terms with it. Like, I was the one that was doing heroin.
Roughly 10 years after being on pain medication, Kratzer overdosed. He was found by his father on his father's birthday, which began the start of his journey to recovery.
Here at Detox, it is going to be a majority of group and then individual therapy as needed.
Japanga says several veterans come through their programs from in-state and out-of-state to better tackle their challenges, including opioid addiction, a prevalent issue in our veterans community.
Sometimes they need ancillary support outside of the VA, and it's there that gap starts to exist where the systems become disjointed.
According to the Arizona Department of Health Services, more than 2 people die from opioid overdoses each day just in Arizona.
I remember I ran to the bathroom and broke down and started to cry, and one of the guys I was in treatment with came into the bathroom and he's like, "You don't have to do that in here. There's no shame and feeling, like this is a part of the process."
Since Kratzer's recovery treatment at Footprints, he has taken on the role of regional outreach manager, helping others who were in his shoes 4 years ago to realize there are better days ahead. Footprints to Recovery says that 1 in 7 people will develop a substance abuse disorder in their lifetime, while only 1 in 10 will actually receive treatment. This February marked 4 years of sobriety for Kratzer. In the Media Center, Madeline Haller, Cronkite News.
As federal authorities seize increasing amounts of drugs such as fentanyl and methamphetamine through ports of entry, towns across the southern border are being forced to combat the effects of fentanyl on a local level.
Cronkite News reporter John Cardinelli visited 2 of them who are tackling the problem in different ways. John?
We traveled to San Luis near Yuma and also to Nogales, Arizona to speak with law enforcement officials there and learn more about what they're specifically dealing with.
Dealing with a lot of clandestinely made fentanyl. They're the M30 pills, that's what they call them.
Lieutenant Marco Santana with the San Luis Police Department knows firsthand the impact fentanyl is having in his community.
2019, we've had it's a little bit, been more issues actually, and we've got about 15 non-accidental overdoses. 1 person passed away this year.
Fentanyl, a synthetic opioid that's 80 to 100 times stronger than morphine, is being intercepted at higher rates through Arizona's ports of entry. Narcan, which reverses opioid overdoses, has saved 14 lives in San Luis since the beginning of the year.
Every sworn member of this police department is trained in how to use the Narcan.
So every officer within our department has 2 canisters or 2 applications of spray.
While in San Luis, they've seen a slight uptick in the use of fentanyl, 323 miles away in Nogales, Sheriff Tony Estrada says his department is trying to prevent Santa Cruz County from being used as a fentanyl pipeline. He says they're understaffed, leaving much of the drug seizing operations up to federal authorities.
Including myself, we're 38. We're below the Bureau of Statistics recommendation of 2.5 per 1,000. At 2.5, we should have over 60 deputies. We have 38. At the low end, at 1.5, we should have 41. We're 38. And that's remarkable because it's a very robust, active community with a lot of drugs coming through here, and families on both sides of the border for generations have been involved in facilitating the drugs, that we don't have more personnel.
As you can see here in Nogales, they've put up concertina wire to try and stop people from jumping the fence as well as transporting drugs. However, Sheriff Estrada believes that this will not stop the flow of drugs from coming into the U.S.
There have been over 100 drug tunnels that have been discovered here. Why? Because the cartels will find a way, and the wall is not going to stop them.
Corporal Oscar Mesta with the Nogales PD says their strategy for combating the flow of fentanyl is actually some good old-fashioned police work.
We started a new CAT team, which is Community Action Team, and we go out, door to door, talk to them. We take care of the small things, because how do you get information? How do you actually go and be proactive? You make contact with the citizens. They're your eyes and ears out there. They tell you, hey, they're using this house for this. That vehicle is being used for this.
To Lieutenant Santana, a similar community-involved task force will launch February 28th in San Luis, Arizona. The hope is that by getting residents involved, the number of overdoses will go down. In the broadcast center, John Cardinelli, Cronkite News.
It's nicknamed the baby blues, but that doesn't really capture the difficulties women with postpartum depression deal with.
The condition is described as intense sadness, anxiety, or even despair some mothers feel up to the first year after giving birth. According to the American Psychological Association, around 1 in 7 women experience postpartum depression. Symptoms can appear days or even months after childbirth, and without treatment, these symptoms can last for several weeks or months. Cronkite News reporter Madeline Haller talked with experts about the condition and how this new drug could help.
Who experience postpartum depression often feel alone or misunderstood while dealing with their newfound feelings. For some, it's a challenge to pinpoint that they need help outside of their home. I spoke with professionals who recognize that the FDA's approved postpartum drug is a major medical innovation. The FDA's postpartum drug Zulresso is marketed to cost between $20,000 and $35,000, not including the cost of the hospital stay. Deanne Davies of Summit Health says the medical community is excited about the FDA's decision to make this drug available.
We know that some women benefit from being involved in support groups, some benefit from therapy interactions, and some benefit from use of pharmaceuticals. So we are very hopeful. I don't know that this drug is one that we necessarily say is going to fix everything, but it sure does take us down the right road.
The drug is administered through IV over a 2.5-day period. Charla Best, Chief Executive Officer of Women's Health Innovations of Arizona, says there is not enough resources with those suffering with postpartum depression in Arizona.
A lot of times moms have a hard time kind of talking about what's going on. There's such a stigma associated. So if they talk to their doctor and their doctor doesn't know where to send them, we have created those relationships so that way the doctors know exactly where to send moms.
Women's Health Innovations of Arizona was created to better serve men, women, and families, including those who experience mood disorder after pregnancy.
The combination of support, medication, counseling, those are usually the best kind of method in terms of getting families and women as well as possible so quickly.
We need to shift our thinking and shift our practice to include more of what is supported.
In Arizona, the rate of women who experience postpartum depression fares slightly below the national average at nearly 13%. Based off the clinical trials, the approved drug is said to work within hours opposed to weeks or months. In the broadcast center, Madeline Haller, Cronkite News.
More than 7 million Americans struggle with post-traumatic stress disorder. One unique treatment is called EMDR, eye movement desensitization and reprocessing.
Cronkite News reporter Bryce Newberry joins us live with a look at how this treatment is helping people.
This is one example of EMDR. It's a treatment that's being used by therapists all over the country. Researchers have found the therapy is quicker and more effective than trauma-focused cognitive behavioral therapy. And it all comes down to the human eye.
We do have major breaking news.
That's the voice of Daniel Clark.
This is very, very tragic.
This is the day he'll never forget.
4 of my friends were killed, and I haven't been here since 2008.
Here is where 2 news helicopters crashed back in 2007 after following a car chase. This scene, combined with all the other tragic ones he's seen in 20 years as a TV news photographer, eventually became too much to handle.
Most people will sit there and go, you know, here's a good restaurant over here, here's a good place to get a massage, or, you know, a great place to get discounts on clothes or whatever. And I'm driving around going death, 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 home invasion, house fire, quadruple shooting, and I can't drive around town.
He stopped working in November after someone pointed out what he already knew.
I've been dealing with PTSD for 10 years, and I see it in your eyes, and you have it. And I was done.
Clark decided to pursue EMDR therapy, a type of treatment for PTSD that stands for eye movement desensitization and reprocessing. It helps people process traumatic events in their brains to neutralize the feelings that come with past struggles. Laura Fontaine practices EMDR at her Mesa office.
Sometimes we have symptoms or behaviors that crop up in the present that are related to triggers, and the triggers come from things that happened to us in our past.
The therapy starts with grounding techniques to help prepare a patient for the processing phase.
I have people run it through their brain like a movie and pause it at that moment that feels the worst. And what's that freeze frame image? That gets your brain really into the meat of that memory.
And then the reprocessing starts.
We start moving the fingers, or we can tap. Some people will have light bars. There are, some people call them tappers or buzzies that you can hold, and it all provides dual attention stimulus.
The EMDR International Association says the therapy is similar to what occurs naturally during dreaming or REM sleep, and can be thought of as a physiologically based therapy that helps a person see disturbing material in a new and less distressing way. For Clark, finding a therapist who actually believed he had PTSD was the first hurdle to getting started.
As soon as I said I'm not in the service or anything like that, it was instant disconnect. Like they shut down, they're like, and they had that look like, what do you know about PTSD?
It was the first step to saving himself and his marriage.
She told me, she goes, I'm glad I don't have to ask you how your day was. And the reason why was because everything was death and destruction.
Daniel's wife always asked how his day was until he stopped working last year.
When the person that you love, that cares about you, and is being very supportive through all of this, it's also going, I don't want to know how your day is anymore. Your relationship's going to be done.
Clark hopes that sharing his story will encourage people, especially in newsrooms, to open up and be comfortable talking about their own struggles. He actually went back to work yesterday. He's working a little bit less and on some lighter stories while he undergoes the treatment, and there's really no estimate as to how long it lasts for each individual patient.
Thank you, Bryce.
In an effort to prevent the risk of cancer for first responders, a community initiative is working to detect those signs early, which can save lives. Cronkite News reporter Amani Stevens learned more about the Joint Cancer Screening and Early Detection Program in the Valley. Amani?
First responders put their lives on the front line, but sometimes they have to step back to take care of themselves. A Valley firefighter had to do just that after receiving a screening he says saved his life.
Time. You know, if we can't prevent cancer, we can catch it.
And that timing matters for Jason Underwood.
This is the last kind of guy that you would expect to have cancer.
After receiving a free screening in November, doctors with the Vincere Cancer Center said he had thymoma cancer because the day-to-day job duties put him and other first responders at a higher risk.
We're exposed to a lot of different chemicals. When things burn, they put off different chemicals because they change composition and stuff. And then we're next to diesel engines running all day.
And often the symptoms go unnoticed.
And Jason is a result of that. 42 years old, in shape, asymptomatic. He found out he was diagnosed with a carcinogen or with an active form of cancer, and they were able to go in there and fix him. And now he is healthy. He's on a road to recovery.
A shift in medical conditions that Underwood says first responders now deal with.
When I started, the big thing was cardiac issues. People were dying from heart attacks because they're out there, they're not eating healthy, they're not taking care of themselves, they go out and exert themselves too much, and then obviously they have heart issues. Now it's switched to where more firefighters are dying from cancer than they are heart attacks.
Today, he is most thankful he'll be there for moments he could have missed.
That was probably the most stressful part of it. You know, just my family, my wife, and my kids, thinking that I may not be there for them.
The screenings are free of charge, and they've started a First Responder Friday where testing is available. Live in the control room, Imani Stevens, Cronkite News.
Riding to raise money. A Phoenix Harley owners group is raising money for a children's summer camp in Prescott.
Cronkite News reporter Alexis Pulick spoke to bikers about helping burn survivors.
Early this morning, hundreds of bikers gathered at Buddy Stubbs Harley-Davidson in Phoenix. They enjoyed coffee and snacks before embarking on a 260-mile ride for a cause.
Today is our 19th annual Wednesday Ride for Kids. It's our annual event where we get out to support Camp Courage, Burn Camp for Kids.
The Arizona Children's Burn Camp helps youth burn survivors by providing a free therapeutic camp every summer in Prescott.
We all remember it's hard enough to be a kid. And, you know, children are hard on children, and these kids face challenges that none of us can, through no fault of their own, they suffer burns. This camp is so close to our heart because these kids get that opportunity to learn to cope and to become stronger despite those handicaps.
The Phoenix Harley Owners Group hosted the event today. However, they have the support of the entire biking community.
You know, it doesn't matter whose event it is, whether you're part of the organization or not. Everybody's part of the brotherhood of and sisterhood of riding motorcycles. We, you know, on this ride, somebody breaks down alongside the road. Doesn't matter if you're wearing the same patch that I am or no patch, or if you're a motorcycle on the side of the road, somebody's going to stop and help you.
Ellis hopes the ride will not only support the camp, but show the softer side of bikers.
My experience with the biker community and the culture is that most of us, you know, we really enjoy what we do. We really enjoy riding, and I think there's some part of all of us that wants to give something back. And I just hope that's demonstrated here, that somehow that softens the reputation of the biker community.
That's it for this special edition of Cronkite News Tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.